Hi PSA members. Last week, Steve and I, along with our other PSA staff, were in Tasmania supporting the students and attending the NAPSA Congress. If you haven't had a chance to look at the updates from last week, make sure you do so. Many of you would also know that the TGA has recently approved the new RSV vaccine, Arexvy. This week at PSA, we are ramping up our conversation and advocacy for pharmacists to be able to provide more vaccines to help increase immunization rates for Australians across the country. Many of you would know that this year started from the 1st of January. This year we now have the NIP VIP program. However, if nothing else changes, we still can't administer RSV vaccines when it becomes available later this year. So we truly believe that pharmacists should be able to provide these vaccines to anyone that's eligible, and we can make a significant contribution. Also this week, the Scope of Practice Review, or the Unleashing the Potential of the Health Workforce Review, chaired by Professor Mark Colmack, they have now released the first issue paper. We are continuing our efforts here to highlight the three key barriers, being systems, regulatory and financial barriers that are impeding pharmacists from practicing to our full and top of scope. We're continuing to advocate for pharmacists and community pharmacists to act as urgent care clinics across the country, providing acute urgent care to a range of common and acute conditions. We're continuing to advocate for pharmacists to be embedded in multidisciplinary team wherever medicines are used. We also continue to advocate for pharmacists to play a key role in the management of chronic health conditions. If you haven't already provided your feedback to our Pharmacist in 2030 consultation, we ask you, would really welcome your feedback, and the consultation would end in mid-February. So please take some time, if you can, to give us some feedback around what you think the future of the profession would and should look like moving into 2030. Now, have a good long weekend, all of our PSA members. I know that many of you will be working throughout this weekend to serve your local community, but please take some time to look after yourself.